Top stories. DPP throws out Dr. Drew's bribery case against Eugene Hamilton. Criminal prosecution training could improve law enforcement in St. Kitts and Nevis. We explore the COVID-19 situation in Anguilla. And internationally, India's healthcare system continues to be burdened by a COVID-19 second wave.
Hi, I'm Andre Huey and welcome to this edition of the SKN Newsline Newscast on Channel 95.
The bribery case against Member of Parliament Eugene Hamilton, brought by St. Kitts Nevis Labour Party Chairman Dr. Terence Drew, has been thrown out by the DPP Valston Graham. More in this report. The Director of Public Prosecution, DPP Valston Graham, has discontinued the matter of bribery brought by Dr. Terence Drew against Member of Parliament Eugene Hamilton. Mr. Graham told reporters on Monday that the matter stood no reasonable chance of succeeding in court, hence the reason it was thrown out.
I would have taken over the prosecution of the private complaint that was instituted by Dr. Terence Drew against Mr. Eugene Hamilton. Having took over that prosecution, Mr. Delano Bat of Queen's Counsel provided me with the statements upon which, or the evidence upon which, founded the two prosecutions. He previously wrote to me and asked for me to give consideration of independent conduct of the prosecutions from my office. Along those lines, I decided and sought the opinion of two independent criminal prosecutors, one in the post of Dr. Henry Brown, Queen's Counsel, and also the other in the post of Mr. Oris Sullivan, the Director of Public Prosecution of Montserrat. I received their independent opinions, and their opinions were presented unknown to each other. Based on the opinion that they would have given to me, my own review of the law and of the evidence, I came to the conclusion that the charge of bribery and the charge of cheating against Mr. Hamilton had no realistic prospect of success. In that regard, I discontinued matters before the magistrate.
Mr. Graham gave further explanation for his decision.
There are two tests the prosecutor must apply in his assessment of whether or not a prosecution should be instituted or whether or not the prosecution should continue. One is the first test. Is there a realistic prospect of success? That is, can a reasonable magistrate or jury, properly directed on the law, come to the conclusion that the person might be convicted? If that test succeeds, then I'll go on to ask the second test, the public interest test. Is it in the public interest that the matter should be prosecuted? The more serious the matter, the more likely that the matter should be prosecuted. If the realistic prospect of conviction test fails, then there is no need to continue to consider the public interest test. In this case, both independent opinion form that view. I am not bound by their opinion, because to be bound by their opinion will fetter my own constitutional discretion. I consider their opinion, and having considered the opinion, I did my own independent assessment of the evidence, consider the law and the matter, and then the code for public prosecutors, and then I came to the conclusion that neither charge there was a realistic prospect of a conviction, and I discontinued the matters.
Meanwhile, the DPP said while it was not illegal for gifts to be given to constituents by parliamentary representatives or candidates in an election, it is the intent of the gift that constitutes a criminal offense.
There is nothing illegal about a candidate or a member giving a constituent a gift. I think that's something that needs to be understood. So any member, whether during political season or otherwise, can give a gift. It's the intent to which that gift is given that creates a criminality. If the gift is given with an intent to influence the voter in terms of how to vote or not to vote, that is what creates the issue of bribery. And insofar as cheating is concerned, the evidence simply did not support any cheating. So in terms of general conduct of election, that was not part of my consideration. I consider that to be irrelevant to my consideration. My consideration is grounded strictly on the evidence and on the law and on the code for public prosecutors. And on all three fronts, I found the case as wanted.
The DPP said while his decision is not appealable, it can be subjected to judicial review. Efforts to reach Mr. Hamilton or Dr. Drew on Monday were unsuccessful. The DPP had taken over the criminal case brought by St. Kitts Nevis Labour Party Chairman Dr. Terence Drew against the People's Action Movement's Eugene Hamilton, alleging, among other things, bribery. At the time the matter was taken over by the DPP, Dr. Drew's legal team expressed reservations about the DPP's decision and statements he made at a press conference claiming that his actions caused doubt in his independence to take over the case. An early meeting held between the U.S. government and the Caribbean community could be an important shift in U.S. foreign policy toward the region, as SK Newsline's Glenn Bart reports.
St. Kitts and Nevis' Foreign Affairs Minister Mark Brantley described the first meeting with the Biden-Harris U.S. administration as one that is positive for the interests of the Caribbean community. The 21st April virtual meeting of several foreign affairs ministers representing the Caribbean community with U.S. Secretary of State Anthony Blinken of the U.S. Department of State was focused on health, security, the economy, and climate change issues. According to Minister Brantley, the decision of the U.S. administration to hold talks with the Caribbean community this early in its months-old administration strongly suggests that the Caribbean is back on the agenda of U.S. foreign affairs.
I think that the Caribbean today was served well by our foreign ministers, and that we advanced an excellent case. We prosecuted the issues in a way that there was clarity and appreciation from our American friends. We look forward very much to a good relationship with the Biden-Harris administration, and we look forward to engaging with them time and time again to ensure that the mutuality of interests, the fact that this is in everybody's best interests, that partnership works to the benefit of all. We would anticipate that we will continue to engage with the United States at the highest levels. What I think is useful is that at a very early stage in this administration, they've reached out to us. I think that's a very, very good sign from the Biden-Harris administration that the Caribbean is going to be back on the agenda, because let's face it, the Caribbean has not featured on the U.S. agenda for some time. The Biden administration has sent an important first signal. They didn't send an ambassador, they didn't send an assistant secretary, they sent the Secretary of State himself, a cabinet member, to engage with us, and we engaged today, I think, just under 2 hours. On issues that are pressing.
The Minister of Foreign Affairs believes that with further and regular dialogue, the mutual interests of the Caribbean community and of the U.S. government may be tackled in the spirit of partnership. Glenn Bart reporting for SKN Newsline.
When we come back, criminal prosecution training course could improve law enforcement in St. Kitts and Nevis. Elliot's Funeral Parlor is the first licensed embalmer in the Federation of St. Kitts and Nevis. We have a friendly and professional staff. At Elliot's Funeral Parlor, we offer a wide range of packages from $6,500, homegoing service at chapel, locally made caskets, tailoring of outfit for deceased of your choice, wake, overnight with slideshow, funeral, death announcement, obituary, booklets, family pin-ons, memorial books, preparation of funeral arrangements, wreath, fresh and artificial. For further information, call 469-3298, 664-2007, or 660-0186. Elliot's Funeral Parlor in Gingerland, Nevis. Dedicated to those we serve.
I eat some veggies for dinner. Let me just check the amount of sodium in this can. Oh no, this is too much. Let me try our next option. They did say it's healthy to consume less salt. This is much better. I am salt smart.
Football is back, and the St. Kitts and Nevis Football Association will be bringing you live football on its website, www.sknfa.com, with Premier League Live. Without fans in the stadium due to COVID-19 protocols, you can now watch every single Premier League match this season on www.sknfa.com and click on Live TV. Games are shown live on every match day with halftime and post-game shows. It's Premier League Live. Commentary, analysis, action. Never miss a game.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Auto Plus Car Wash, located on the College Street Gut, Bastyr, St. Kitts. Bring your car to Auto Plus Car Wash to remove water stains, wiper marks. Get your doors, roof panel cleaned, seat floor mats, buffing, headlights, and engine wash. You get quality service at the best price at Auto Plus Car Wash. They really care for your car. Call 765-5140 or visit them on the College Street Gut, Bastyr, St. Kitts. Auto Plus Car Wash, where the service is number one.
A recently launched criminal prosecution training course for members of law enforcement and auxiliary services could help bring about greater success in criminal cases. More from Glenn Bart.
Several officers of the police force and auxiliary services are currently engaged in a criminal prosecution training program aimed at enhancing the standard of case file management. Speaking at the 26th April opening of the course, Assistant Commissioner of Police Andrew Mitchell, who heads the Crime Directorate at the St. Christopher and Nevis Police Force, described the program as a capacity-building initiative and a collaboration between the police force and the Office of the Director of Public Prosecution.
You will be called upon to provide advice in respect of who to charge, what to charge with, or what to charge them with, and the number and severity of the charges. In performing that role, your decision heavily influenced the short and long-term outcomes of the people impacted by the system. The consequences of your decisions can mean the difference between the success or failure of someone touched by the judicial system and the overall safety of the community. Your discretion requires you to make decisions to achieve discipline, public safety through the lens of justice.
In building greater levels of performance and responsibility, ethical issues and discipline are important for success in matters involving the prosecution of criminal cases, according to the Director of Public Prosecution, Ralston Graham.
When major crime is done, and it is done now, politicians are happy. Especially Minister of Tourism, he's happier. Hoteliers are delighted. Commissioner of Police is very pleased and happy. When minor and petty crimes are up, small businesses are devastated. They lose confidence in the police. They lose confidence in the justice system. The small man in the communities are the ones who generally suffers most from petty crimes. When discipline is high in any organization, morale is high, performance is high, and the organization enjoys overall success. When discipline is poor, morale is low. If I could say Inspector Wallace getting away more than doing what she like, and face no consequences, or even if she's charged, the conduct of the hearing is performed so poorly that she walks and she goes out and she laughs. If I could say that, I'll say, well, you suck your teeth. And I say, well, why should I do better? But when a member of an organization witness that the organization takes a hard stance on discipline, they themselves have to take personal responsibility to ensure that they conduct themselves accordingly, but also their peers and their subordinates conduct themselves accordingly.
The interactive training course is one of several training programs to be undertaken to enhance standards at the police force. Glenn Bart reporting for SK Newsline.
Finally, a call is being made for more digital innovations to be applied to healthcare. There is need for improvements in the application of digital technology in the delivery of healthcare in the Eastern Caribbean in a bid to enhance the quality of care to its citizens. That was one of the focal points of the discussion organized by the Eastern Caribbean Central Bank on what lessons we as a region would have learned from the pandemic and its impact on health care. Dr. Caroline Radix, head of the Human and Social Division of the OECS Commission, was one of the panelists. She said the COVID-19 pandemic has taught us to apply digital innovations to health care.
This COVID pandemic has taught us we've done things digitally within a very short period of time that we've been planning to do for a long period of time. And the health system is no different in terms of how we've been handling care within the COVID pandemic. And we need to use what we're learning to be able to expand and reduce the cost with regards to and increase the quality with regards to treating diseases at that level, which we must have and we must always have. And so we need to be able to do it differently, working together to pool resources and tapping on resources that are not physically in our space.
Meanwhile, Mr. Damien Grays, professor in the Department of Humanities and Social Sciences, said in the region there's a scattershot approach to budgeting for health care.
When we look at the health budget, we have to begin to be more targeted. As far as I see it now, and using my experience from before as a Minister for Health, we have a scattershot approach to the budget for health rather than a rifle shot approach. So we put in a lot of things. We say we're doing this, we're doing that, we're doing that, we're doing that, we're doing that. We do not look at the overall picture as far as I'm concerned. Maybe we are doing that a lot more these days, but we are not there yet. A more targeted approach within the confines of our framework, within the confines of the information we have before us. I mean, household surveys are sadly absent. So a lot of those things not on the periphery of that are important as part of the composition of your health planning and policy is absent. And then I'm saying, if you're looking at more affordable and equitable health, you have to see it as being inextricably linked to the elements of what I call universal access to healthcare. So there has to be the increased and more effective community service, the health checks and awareness. All of that is part of the gambit. Health checks and awareness in schools, in communities, increased community facilities to stimulate exercise and other recreational activities like sport and so on. And all of those things will come in. Your special concessions for certain targeted areas. These are the things that we have to look at. So we have to be a lot more innovative, more rifle shot in terms of our approach and strategy rather than the scatter shot. And basically, against the backdrop of the framework for public health and the essential public health functions, we should be able to have a better approach.
The ECCB session was entitled Digital Dialogues, which is a regular virtual meeting of the minds in the Eastern Caribbean discussing a wide range of issues of regional significance. Andre Huey, SKN Newsline. When we come back, a look at the COVID-19 situation in Anguilla.
The SKN Newsline website now offers you more news. Log on to www.sknnewsline.com for local, regional, and international news. You can also watch the latest newscast and keep abreast with news in sports, all from sknnewsline.com. That's www.sknnewsline.com. News at your fingertips.
You know, it's me, Mr. HE, and I'm here with one message. Roll up to roll out. We all know how difficult things have been during this COVID-19 pandemic. While we continue to wash our hands, wear a face mask, and practice social distancing, how about we take it one step further and get vaccinated? Call the nearest health center to find out if you are eligible to be vaccinated. Or you can contact the Ministry of Health at any one of these numbers down below. Don't be discouraged by the negativity. We all have a role to play in protecting this federation. So, St. Kitts and Nevis, let's roll up to roll out.
Stay abreast with news on St. Martin with SMN News. Visit www.smn-news.com for up-to-date news, scoops, opinions, and hard-hitting facts. SMN News, we tell it like it is. Visit our website www.smn-news.com.
It's the new and improved SKN Newsline Android mobile app. With the SKN Newsline app, you can watch our news reports, the SKN Newsline Newscast, sports, special features, and so much more. You can also send us a WhatsApp or call us directly. Go in the Google Play Store, search SKN Newsline, and download the app today. The SKN Newsline mobile app. News on the go.
Junior, can get popcorn, please? Don't tell Dave. Want some to please? I can get some salt. More, please. Boy, take a pack up from Junie.
Welcome back. We turn our attentions now to regional news.
Anguilla is on a government-mandated 14-day lockdown since midnight April 22nd due to a surge in COVID-19 cases on the island. Up to news time Monday, the number of positive cases were over 50. Governor of Anguilla, Ms. Delini Daniel Severnatam, gave an update along with Premier Dr. Ellis Webster Monday afternoon.
As of midday today, there are a total of 51 persons who have tested positive linked to the cluster of COVID-19 cases first identified on the 21st of April. To date, no one has been hospitalised, though there are several symptomatic with symptoms including fever, cough and flu-like symptoms. All cases are under isolation. The exposure locations have been identified and aggressive contact tracing and surveillance is continuing. In respect of the public health measures, in order to contain the situation, Executive Council have taken the difficult decision to increase the public health measures in place. These include to limit the hours that essential services may open to between 6 a.m. to 4 p.m. only, and until the 6th of May, people should only exercise within the boundaries of their own premises. If this is communal, safe social distancing should be observed. These measures will come into place tomorrow.
Where will we get the money from to increase salaries was the cry of CEO of Gaisuco, the Guyana Sugar Company, to striking workers at two of the country's prime sugar factories recently. More in this HGP TV news report.
There is a disconnect that 102% of our revenue is spent on wages and salaries, and on top of that you have the audacity to tell us that we're not trying our best. Where are we going to get more from?
That's the question the Chief Executive Officer of Gaisuco, Sis Narain Singh, is asking following strike action by workers of the Blairmont and Albion Sugar Estates earlier in the week, who are calling for an increase in salaries. On April 16th, workers attached to the Iflot estate also protested for increase in earnings. Meanwhile, the CEO made a plea for all stakeholders to collaborate with the aim of rebuilding the industry.
I am calling on all the stakeholders, please let's work in a collaborative manner Let's rebuild this institution brick by brick.
The Ghana Agricultural and General Workers Union, GAWU, via a statement on Thursday said that the corporation CEO as well as the public relations officer, Indira Badal, have prejudiced ongoing discussions by seeking to resolve the issue via the media, which it says, if found to be true, is disturbing. While highlighting that the CEO seems to be contradicting himself by stating that the corporation is ready and willing to negotiate salary increases, yet asking where they're going to receive money from for such, GAWU underscored that the $9 billion injected into the corporation in 2020 was mainly to offset capital and not current expenses. The union further highlighted that in spite of its constraints, the corporation still managed to garner enough money to offset certain statutory obligations as well as creditors. The Gaisuco CEO assured that the corporation will do whatever it can to help realize the wishes and demands of the workers.
We are committed to the workers. We will do everything within our power to make something happen.
GAWU concluded in its statement that both the CEO and the public relations manager expressed their interest at reaching a win-win situation and were committed to working along with the workers and the union, while also positing that it remains willing to engage in frank discussions and to seek to address in a respectful manner the outstanding issues. We are hopeful, the union said, that better sense will prevail and the corporation would treat the workers with greater respect and dignity. Wendell Badry, HGP Nightly News.
India may be experiencing the world's worst outbreak of COVID-19, but millions of people still turned out to elect regional leaders in the state of West Bengal on Monday. It's one of 5 states that has held elections in recent weeks, despite the drastically rising number of infections. Hospitals across the country are facing a critical shortage of beds and oxygen. The US and UK have responded by sending life-saving medical supplies to India.
We want to provide them all the support because they're close friends, increasingly important partners, but also we need this kind of international collaboration if we're going to get through the pandemic. We're not going to be safe until we're all safe.
Once the aid arrives, armed police are deployed to escort the precious cargo. That says regional states accuse each other of stealing oxygen. Soldiers guard a newly opened COVID-19 care centre in New Delhi. There are 500 beds so far, not enough for the many family members who couldn't get their loved ones admitted to hospitals.
Even here, people are being turned away, being told that they can only be admitted if they have a referral and have pre-registered. The centre also says that it can't accept those who are critically ill, leaving many with nowhere else to go.
As many people die because of a lack of help, Prime Minister Narendra Modi has been criticised for allowing the large political and religious events to go ahead. That led to the government asking Twitter to take down dozens of posts critical of its handling of the pandemic.
This stems primarily from the fact that this government does not take very kindly to criticism. It's very sensitive to criticism, and also from the desire to try and control the narrative. As days have gone by, this government has come in increasingly for criticism, increasingly from citizens, and also, I may say, from the court.
On Monday, the Madras High Court in the southern city of Chennai said India's election commission is single-handedly responsible for the second wave of the coronavirus. Elizabeth Puranam, Al Jazeera, New Delhi.
Joining us from New Delhi is Rajiv Dasgupta, Chairman of the Centre of Social Medicine and Community Health at JNU. Many thanks for speaking to us here on Al Jazeera. Let me first touch on something we saw there in Elizabeth's package. You're a community health doctor. The fact that millions of people are still turning out to elect regional leaders today in the state of West Bengal, how damaging is that to the situation we're seeing in India in terms of COVID?
Well, as we know, the Election Commission has been trying to enforce the standard operating procedures, but it's been an uphill task. If we talk of West Bengal, what's worrying for West Bengal at this point is a 20% plus positivity rate. And that really implies that it is in an ascending phase of the second wave. And these these activities are certainly going to have a role in the transmission.
So what do you think is going to happen next? Are we going to see the COVID situation getting worse in, say, the rural areas and move out of the cities?
Well, several states which are predominantly rural, for example, Chhattisgarh or Bihar, they are also reporting relatively high R values, and the R value above 1 implies an ongoing transmission. So on an average, India's R value is 1.27 now. Virtually all states are above 1, which means that we would need some more time for this to at least stabilize before it slows down. So in short, all states are in a rising phase. There would be a difference between the rural areas and urban areas, obviously. But if the experience from some of the states is in rural areas seem to be somewhat more affected now than in the first phase, but that's something we need to watch out for.
Let's get into that more, because my understanding is there are a number of different strains of the virus in India now, as opposed to the first time COVID struck. You have the UK strain, the South African strain. You also have this mutant Indian strain. Which strain is causing the most concern, do you think?
Well, the federal government did well to put together the consortium of 10 national level laboratories in end December. So the UK strain was identified as early as 28 December. The B1617, popularly the double mutant, but that's not really the term to be encouraged. The 617 was identified in early February. So it is possible that these are linked to at least the initial rise in cases in Maharashtra and Punjab, which accounted for two pretty large states, Maharashtra being the second most populous state, both accounting for anything between 75 to 80% of daily new cases till about the end of March or even early April, along with another 2 or 3 states which accounted for about 5% contribution each to the national new cases. So in short, it's most likely driven by these new variants, and the other issues such as the election or the religious congregations and so on, they came much later, to be honest. So therefore, as in all countries, second waves are led by emerging mutant forms.
So now we are talking about vaccines. We're getting, or India is getting a lot of help from the international community, sending across shipments of either oxygen or vaccines and so on. How effective are the vaccines going to be against all these different strains?
That is something that the vaccinologists and laboratory scientists are engaged with. At this point, 2 vaccines are already in the program, as we know. The third one has received authorization, the Sputnik from the Russian groups, and the initial batch of the Sputnik vaccines are going to be directly imported from Russia and inducted into the program. So we believe that these 3 vaccines, which will be available in the program, 2 are already available, and that would be strengthened, would certainly have a role in contributing to building up the population level immunity. But that's not really the immediate term. The immediate term over the next few weeks is about providing medical care, and more importantly, seamless medical care, as the central government today underscored.
Many thanks for your time, Rajiv Dasgupta, Chairman of the Centre of Social Medicine and Community Health at JHU.
Thank you.
In tennis, we have results in the winners of the just concluded MoneyGram Easter Tennis Challenge held at the Warner Park Tennis Courts. In the girls' under-12 category, Tamu Jibin was the winner, the runner-up Levancia Brown. In the boys' under-12, the champion was Kwani Bryan and the runner-up Levon Brown. In the boys' under-16, the winner, Denelson Liebert, runner-up Silandre Bryan. And the girls' under-16, the winner, Jada Brown, runner-up Tamu Jibin. In the men's doubles, the team of Jonah and Sethir defeated a resurgent team of Andrew and Tomoy taking the final set 7-5 and winning the championship 6-4, 6-7, 7-5. The St. Kitts and Nevis Tennis Association thanked Platinum sponsor MoneyGram and Gentons International that sponsored the balls for the junior category as well as the male finals.
This has been the SKN Newsline and Newscast on Channel 95. If you want more on these stories, you can visit our website at www.sknnewsline.com. From all of us here at SKN Newsline, I'm Andre Huey. Thank you for watching.